Hi everyone, my name is Melissa Jammal and I'm a researcher and academic from Western Sydney University, and it is an honour to be presenting my work which is focused on promoting the health and wellbeing of informal stroke carers as a part of this Spotlight series. Like many people watching this, I wear a few different hats, including being a carer for my grandmother and grandfather. I completed a Bachelor of Occupational Therapy and I've worked as an occupational therapist in supporting people who have a disability. Currently, I am pursuing a PhD and my research is really inspired by my family, my caring role, and that's what's encouraged me to pursue research and given me this unique insight into some of the experiences, challenges, and needs of carers. So what is this project? Well, my PhD research includes a series of studies with the overall aim of improving carer health and wellbeing. The first two studies that I undertook collated findings from research across the world that focused on carers' experiences and how this is impacting their health and wellbeing. After summarising this evidence, we completed individual interviews with two very important groups of people who provide care for people that have had a stroke, and that is family members and healthcare professionals. Given the time frame today, I'm just going to be focusing on some high-level findings from the discussions that we had with carers. As a part of this study, we asked carers how they look after their health and wellbeing and what advice they would give to a new carer navigating their role. We identified 4 commonly shared pieces of advice, which I'm going to be sharing with you today. The first is to make time for healthy habits, like eating regular and healthy meals, taking time to exercise, such as going for walks, and taking breaks throughout the day to do activities that carers enjoy, such as reading a book or catching up on a series. The second piece of advice is to adapt daily activities to make things easier or to save time. For example, some carers suggested shifting from in-store to online shopping that is delivered to their home, or organising support services such as therapists to come into the home instead of going to their clinic. Whereas other carers suggested using technology to help them with reminders or organising their schedules. Number 3 is to rethink priorities. Carers told us that it's important to acknowledge that no one can do everything. So it's really crucial to prioritise the activities that are most meaningful. Prioritising meant some activities had to stop, others had to be delegated to someone else, and at other times this meant leaving some activities to a later time. For example, carers said that it was important to do activities that were more meaningful, such as going for a cup of coffee with a friend or going for a walk, as opposed to keeping their home spotless or doing another load of laundry. We know that prioritising activities that support health and wellbeing and social connectedness can actually help to reduce stress and strain. Finally, carers said that it was extremely important to be kind to themselves and take time out when they needed it. This meant asking for help, whether from a family member or friend, healthcare professionals, or formal services like Carers Gateway. Although it can be hard to ask for help, it is critical to utilise services and accept support that ease the physical and mental load of caring. So what have we learned so far? Well, this research has provided important insights into what carers need in a local context, but also how carers can prioritise their own health and wellbeing. Now we need to see this all put into action, and a couple of things that we can do is further develop the resources and information that's tailored to carers. This could include the development of carer programs that support the priorities and needs of carers. As healthcare professionals, we can support carers to develop and put into action realistic strategies that support their health and wellbeing. So where to from here? Well, based on the findings from our study, our evidence reviews, and our conversations with healthcare professionals, we are currently developing a tailored program to support the health and wellbeing of carers in southwestern Sydney. So watch this space. Thank you for your time today, and if you'd like any more information about any of our work, feel free to reach out to my email. You can also scan the QR codes to read about our research. Thank you.